Hi, I'm going to be giving a report on two patients here in the ICU. The first patient I'm going to be giving a report on is the one I consider the most critical at the moment because she's also one of the newer patients we have here on the ICU. She is in room 13. She is a full code. Her initials are LK. She is a 65-year-old female that is allergic to penicillins and Augmentin as well as Demerol. On 10/18, she has Parkinson's. She came in for a stage 2 brain stimulator, and things seemed to be going okay. The following day on 10/19, she came back to the emergency department for aspastic right arm movement, odd behavior, and breathing problems. So at the time, she was ANO times 4. She was transferred to the 9th floor, and yesterday the tech was helping feed her breakfast, and the tech ended up leaving the room because she was going to get her some ice water. And when the tech came back in the room, she had discovered that the patient had choked on some of her food and her lips were blue. So they ended up calling a code blue because she had quit breathing and she had arrested. They did CPR for 10 minutes, gave 1 ampule of epi, and they shocked her twice. At the time, she had no IV access, so they ended up having to give her an IO in her leg. After the second dose of epi, she did get a heart rhythm back, and so they intubated her and they transferred her to the ICU, and that was yesterday. At sometime yesterday, they also bronched her after they had transferred her to the ICU, and they had discovered they had found the food that she had aspirated on. She has a history of diabetes mellitus, coronary arteries disease. She did have an MI in the past and had stents placed. She's had a history of spinal stenosis, bipolar, CHF, back pain, ADHD, hypertension, and hypothyroidism. Neurologically, she is intubated and sedated right now. She is not alert and oriented, so she's ANO times 0. She does withdraw to painful stimulus, though. Her pupils are 3 millimeters bilaterally, and they are equally round, and they do react to light. I was told in report when I came on today that her pupils were not reactive, but for me they've been reactive all day, so there has been some improvement there. Cardiovascular, she has blood pressures have been ranging from 90 to 130 systolic, over 50 to 80s diastolic. She has 1/1 pulses, and her pulses are very weak. Sometimes you have to Doppler them. Heart rate's been in the 70s and distant. She's a normal sinus rhythm, has been all day, and she does have 1+ left lower leg edema. Her lungs are coarse throughout. She does have an ET tube placed. It's number 7.5, and it's placed on the left at 23. And she's currently on PRVC settings with a respiratory rate of 20, tidal volume of 400, FiO2 of 30%, and a PEEP of 5. GI, we put a Tiger tube in her today. It is on the right near, and it's currently at 100. She has Promote going at 60 milliliters an hour with Q6 hour 60 milliliter flushes. She is also on an insulin drip with every hour Accu-Checks. And she has had a BM today. Bowel sounds are present, but they are hypoactive at the moment. Urinary wise, she has a possible UTI because her urine's been cloudy, but she has a Foley in, and her urine output's been adequate. When I came in this morning around 8 a.m., it was not adequate, and we ended up looking into it, and we discovered that her Foley was clogged, so we had to remove it, and I had to put a new Foley in. But ever since then, she's had adequate urine output of anywhere from 30 to 50 milliliters an hour. Skin-wise, she does have some wounds. She has an incision on her right subclavian. She has purple bruising all on her right side, and she does have a bunch of sutures behind her right ear and across the top of her head where they put that stage 2 brain stimulator in. However, the edges are well approximated. They look good, no drainage. Staples are still in there. Everything looks good though. IVs, access-wise, she has a left triple lumen pick. Everything flushes great with it. We did DC her IV that was in her right AC today. As far as drips going, she currently has insulin going, which we've been titrating. It's currently at 0.5 an hour. We're basing that upon what her Accu-Checks are every hour and then adjusting it based on that. She has normal saline going at 100 mils an hour, propofol going at 50, and we did end up turning her Levophed off because her blood pressures have been stabilized all day. Lab-wise, her white blood cells were at 7.1, hemoglobin 9.5, hematocrit 28.9, platelets 188, sodium 144, potassium has been 2.5. We did end up giving her 40 of potassium IV and then also gave her 40 of potassium in her Tiger tube that we crushed today. So we've just been kind of monitoring her potassium. Her BUN is 28, creatinine is 1, phosphate is 4, and magnesium is 2.1. So our goal for her today is just to trying to just improve her mental status. She's intubated right now, and I think it'll be a while before we can extubate her, but we're just trying to monitor her really closely right now, really watching that potassium. We're trying to get it up. And so she is one that I consider the most critical right now of the 2 patients. The second patient I'm going to be giving report on is an 84-year-old female. She's in room 14. She's a full code. Her initials are BT, and the only known allergies that she has is detergent. She gets a skin rash when she deals with detergent, apparently. She was admitted on 10/1 because she was very hypotensive, had black tarry stools from an ileostomy, and I guess it came back positive for blood. She ended up receiving 4 units of packed red blood cells, which led to fluid volume overload. Her creatinine at the time was increased, and it was well over 3. And then 2 days later, on 10/3, it was discovered that she had a duodenal ulcer, and so they ended up clipping it while she was in the GI lab. She was also given Lasix to get rid of that extra fluid that she had accumulated. On 10/4, she had an echo, and it showed a left EF of 65%. They also noticed that her mental status was declining. So they ended up doing a head CT on the 4th, and it came back negative. Her ammonia level was checked, and at the time it was 77. So also during that time, she had a 24-hour urine output of 70. Then on 10/5, she was intubated due to not being responsive and was in both respiratory and metabolic acidosis. They ended up giving her dialysis the 6th through the 8th to pull off all the extra fluid that she just kept accumulating. And ever since then, her creatinine's slowly been improving. On 10/13, they did a thoracentesis tap, and they drew 1,200 milliliters of serosanguinous fluids off. And then 10/17, she had an EEG, which showed some slowing, and her ammonia level at the time had come down to 27. She has been intubated, but they did do a PSV trial yesterday, and they ended up taking her off restraints. And so our goal is to hopefully extubate her soon. That's kind of been what all of today has been about, is just trying to get her to a point where we feel like she'll be able to be extubated. So history, she doesn't have much medical history. All that we know is she has type 2 diabetes mellitus. Neurologically speaking, she's had improved mental status, especially today. Push and pulls are still weak though, but she is following command. She's been afebrile. She's on no sedation currently, and she's been ANO × 4. Cardiovascular status wise, she's had blood pressures anywhere from 80 to 115 systolic, over 40s to 70s diastolic, 1/1 pulses. Heart rates have been anywhere from 60s to 70s. She does have a pacemaker though, but she has not been paced. She has been anywhere from AFib to having some PVCs. And our goal is actually to keep her MAP above 65. So we've been titrating based upon her MAP as well. She does have 3+ edema on her thighs and 2+ edema on her arms. Her lungs, anteriorly speaking, have been coarse and posteriorly are diminished. She does have an ET tube. It's a number 8 and it's at a placement of 23 with a bite block. And her settings are currently PRVC with a respiratory rate of 18, a tidal volume of 450, 40% FiO2, and a PEEP of 5. GI-wise, she does have a Tiger, a feeding tube in. It's on her right nair at 75. She's getting Osmolite 1.5 at 60 milliliters an hour with Q6 hour 60 milliliter water flushes. We're doing blood sugar checks, AccuChecks every 4 hours. She is getting insulin. Her blood sugars today have been over the 200s, and I did give her 15 units of Lantus today. And she also has a colostomy bag, and I've had an output of around 400 to 600 today. Urinary wise, she does have a Foley in. She has clear yellow urine, and it's been adequate. She's had at least 600 milliliters the entire day. Skin wise, she has a lot going on with her skin. She has thrush in her mouth and on her tongue. She has dusky fingers. We put the bunny boots on her and her SCDs. She does have a pressure ulcer on her right butt cheek, so we've just been making sure that we're keeping that wound clean and that we're turning her every 2 hours as frequently as we can. The pressure ulcer that's on her right butt cheek, there's cream on it, and I have it open to air. And then she also does have gauze over her right IJ because that was removed a couple days ago. IV access wise, she has a right triple lumen pick, so no blood pressures or sticks on the right arm. We've been doing them on the left. I did notice that her pick was flushing sluggishly today, and I think that's because it just is more placement related, so as long as you put your fingers over it and kind of maneuver it in the right spot, then you can get it to flush. She does have fluids going. She has normal saline going at 75 mils an hour, and she does have Levophed going at 9 mics a minute. Lab-wise, her white blood cells were 8.3, H&H 9.5 and 29.9. Her platelets are increased at 370. Sodium's low, it's 132. Potassium is 4.3. BUN at 100. Her creatinine's still increased at 2.3. Phosphorus at 5.8. And magnesium at 2.3. And so based upon how everything went today, Dr. Burks thinks that they can possibly extubate her tomorrow. So that's kind of the goal that we're working towards. And those are the 2 patients that you will have here in the ICU. Thanks.